Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Why Podiatrists Recommend Medical Pedicures for Healthier Feet. A medical pedicure is a therapeutically oriented service emphasizing foot health rather than cosmetic appeal. Foot safety is paramount, making it a good option for people with health conditions that make getting a regular pedicure risky. /r/n/r/NA medical pedicure, sometimes called a medi-pedi, differs from a regular pedicure in several ways. A foot specialist performs a medical pedicure rather than a traditional pedicurist. It is geared toward preventing infection by using sterile tools and being mindful of health issues affecting feet. /r/n/r/n Preventive and corrective care are central to medical pedicures. They aim to prevent problems and conditions that may need medical intervention. With regular medical pedicures, you can prevent foot problems from arising without some of the risks associated with traditional pedicures. /r/n/r/n For example, a pedicure in a traditional nail salon often starts with a foot soak. This may be tempting, but it risks contamination in the tub, which can be a breeding ground for infectious organisms. If you have a cut on your toe or get a nick in the skin, you run the risk of developing an infection. /r/n/r/n But a medi-pedi is soak-free and does not involve water. It prioritizes foot health over appearance. /r/n/r/n Medical pedicures are often performed in the offices of podiatrists, medical doctors who treat conditions of the foot and ankle. You can find a podiatrist in your area and see if they offer this service using the American Podiatric Medical Associations tool. You may also ask a healthcare provider for a referral. /r/n/r/NA medical pedicure is different from one in a spa setting. Typically, the ambiance is sterile rather than soothing. /r/n/r/n The process is usually performed in a podiatrist's office. A certified medical nail technician, MNT, with special nail and foot care training often performs the medical pedicure. The MNT examines your feet and assesses the treatments you will need. /r/n/r/n During the medi-pedi, the podiatrist or MNT will be focused on safely doing the following. /r/n/r/n Medicare and most insurance plans do not cover medical pedicures unless medically necessary. Costs for a medical pedicure can vary by location. Medical pedicures for specific foot conditions will likely cost $50 to $100. In larger cities, such as New York, they can cost $200 or more. /r/n/r/n Undergoing a medical pedicure may not bring with it the luxury of a day at the spa, but it has its perks. The benefits of a medical pedicure include /r/n/r/nrnMedical pedicure is great for people with complex foot issues or health problems and for people with trouble trimming their nails and calluses. The podiatrist and nail techs can advise you on any issues present. /r/n/r/n Not everybody needs a Medicare pedicure. However, a pedicure at a traditional spa or salon can be risky for people with some underlying medical conditions. A medical pedicure should be considered for those with the following conditions. /r/n/r/n Diabetes is marked by poor circulation and slow healing. People with diabetes need to prevent even minor nicks or foot sores. Even mild infections can lead to gangrene, which may ultimately require some form of amputation. /r/n/r/n With diabetes, what otherwise would be routine nail care can be crucial to health, requiring medical expertise. If a foot sore is noticed and effectively treated early, it may save a more severe outcome. /r/n/r/n If you have an autoimmune disease, in which the immune system mistakenly attacks healthy tissues, it can affect your nails and skin. With rheumatoid arthritis, for example, your nails may develop vertical ridges. /r/n/r/n Changes in nails, hair, and skin also occur with lupus. The nails may become rough or thick, and you may notice spots or pigmentation changes on the cuticles. Psoriasis also often affects the nails. /r/n/r/n Treating autoimmune diseases can involve drugs that weaken the immune system, making the person more vulnerable to infection. Preventing infection is important in managing these conditions. /r/n/r/n Cancer treatment may affect your skin and your nails. It may also impair the ability to fight infection or heal wounds, so care is needed when getting a pedicure. /r/n/r/n If you're undergoing chemotherapy, your nails may crack and darken, and your skin may become itchy. With radiation treatment, you may have dry, itchy, red, and sensitive skin. With immunotherapy, there can be nail and skin problems, and with stem cell transplants, blisters and rashes. /r/n/r/n Trained professionals typically perform a medical pedicure in a podiatrist's office. The emphasis is on foot health and infection control rather than aesthetic appeal. Getting a medical pedicure can help prevent foot problems from progressing and is a preferred foot care option for those whose health issues make them vulnerable to infection. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.